Hello, I'm Dr. Kyle Anderson from Cross Lake Veterinary Hospital, and I'm here today to help you better understand a little bit more about cat cardiology.
Dr. Anderson, what is the most common heart disease in cats?
The most common heart disease in cats is cardiomyopathy, be that hypertrophic cardiomyopathy or other types of cardiomyopathy. But cats tend to get heart muscle disease, not heart valve disease, which is most commonly seen in dogs. Cats can also get feline heartworm disease, so it is very important to still keep cats on heartworm preventative as well.
What are the signs and symptoms of heart disease in cats?
The most common signs and symptoms of heart disease in cats are lethargy, weakness, increased respiratory effort, increased respiratory rate or breathing rate, up to and even extreme pain, weakness, collapse, or paralysis of the hind limbs, which we see with aortic thromboembolism.
What types of tests are used to evaluate a cat's heart health?
There are several different types of testing that we use for cat cardiology. One of them is a blood test that checks for biomarkers for muscle damage to the heart, called a cardiac proBNP, which is a good screening test for heart disease in cats. If we do suspect heart disease, we can also do tests like an electrocardiogram to look at the waveforms or function of the heart, checking for arrhythmias. We can also do radiology to look at the lungs to look for signs of heart failure. And we can also do an echocardiogram, which is an ultrasound of the heart, to determine the underlying type of cardiomyopathy or disease present in the heart.
What treatments are available for cats with heart disease?
Cats with heart disease in the past have not really had much for treatments preclinical heart failure. Currently, there is a new and medication that can be used for cats with preclinical cardiomyopathy that's just in the beginning stages of use. We are waiting for more data on this medication moving forward before we start prescribing it here at Cross Lake Veterinary Hospital, but it does have promise to use in cats with preclinical cardiomyopathy. Once cats go into heart failure or have clinical symptoms of cardiomyopathy, there are various other medications that can be used to help manage to help treat symptoms of those sequelae to the heart disease.
How can I recognize an emergency situation related to my cat's heart condition?
Most commonly, we are seeing cats emergently for heart disease that are in respiratory distress, which means they are struggling to breathe with increased respiratory effort, increased respiratory rate, sometimes coughing. They're usually hiding, lethargic, won't eat or drink. Those are emergent cases. The other common emergency that we see are cats with aortic thromboembolism, which is when a clot lodges in the cat's back legs from their heart disease, which can cause severe pain due to lack of blood flow to the hind limbs. And that is one thing that we see is cats crying out in severe pain without use of their hind limbs. Those are emergencies. We can also see cats with heart disease have clot issues that can cause sudden death as well.
Are certain breeds more prone to cat heart disease?
There are certain breeds that can be more prone to cat heart disease. Some of the breeds off the top of my head are Maine Coons, Sphinx cats, Burmese cats, a lot of the purebred cats. So if you do have a purebred cat or have concerns that one of your type of cat may have heart disease, you need to contact Cross Lake Veterinary Hospital and we can help you determine whether your breed is at risk.
What is the long-term prognosis and quality of life for a cat with heart disease?
Prognosis long-term depends on several things. Cats with non-clinical heart disease that are diagnosed with cardiomyopathy, non-clinical meaning they don't have clinical signs, prognosis can be very good because progression of heart disease can be very variable in cats. Cats that are in heart failure or have aortic thromboembolism tend to have much worse prognosis and a much shorter duration of life after diagnosis. So it can be very variable and needs further follow-up and monitoring by your veterinarian to determine what type of heart disease there is and to give you a better understanding of prognostically how well your cat is going to do with that heart disease. Thank you for listening to the video today. If you have any further questions or concerns or suspect that your cat has heart disease or are worried about cat heart disease, please call us 218-692-4400, schedule an appointment, and we can go through any of the concerns you have about your cat's cardiology.